at Newcastle University earlier this year in March. Let me just see. So for me, this has been a bit of a learning curve, working with a slightly different population that we're looking at here. And yeah, so I've been able to meet Fiona on our journey so far, and hopefully we're going to share a little bit about that today. Can I just check everyone can see the slides there?
Yeah.
Apologies if you can also see all the faces on the side of the screen. I haven't quite worked out how to just get the slides on the full screen, but if that's okay for you, we'll carry on like this. So the project we're talking about today is around what we're going to talk about is the patient, public and community engagement and involvement aspects of the design and development of the project around Recovery Navigators. And in particular, we're looking at the evaluation of this role across the North East and North Cumbria. So what I'd like to go through is just to give a bit of background to the study, to add a bit of context to what we want to talk about. I'll go through what the intervention looks like, then describe our study design and methods. I'll touch on the findings and what we're hoping to do with that. And then towards the end, I'll kind of work back really to what our PPIE input has been and the changes that we've made through that and because of that. And then from there, I'll hand over to Fiona, who'll talk about her experience. Sorry, Fiona, do you want to maybe just give a bit of an overview?
Yeah, I think I'll just be chatting about what it's been like to be involved in this project and how I came to be in this project and how I've found it so far. I hope that's enough.
I'm sure it will. I hope so. Okay, so just to get started then, with some background information. Unfortunately, we know that in the North East, we'd suffer disproportionately from alcohol harms, and all of this was made worse by the COVID-19 pandemic, as with a lot of things, I suppose. And we know that there's a group of patients who are admitted to emergency departments on a regular basis due to alcohol problems and the high levels of need that's associated with that because of the chronic nature of the problem and the relapsing nature of the problem. But a big part of that is around mental health needs. Now, I think probably most of us can recognise that alcohol use and mental ill health go hand in hand, but services aren't always set up to kind of deal with that. But there was a study that showed that of patients who were in community specialist treatment, it was found that 86% of those had mental health difficulties. And for me, that's really, it's a staggering statistic, but I think it just sort of demonstrates how linked those two factors are and that we need to make sure those services are addressing both of those needs. But one of the problems that we have is that it's not always quite straightforward to navigate through those services. So what we find is that some patients aren't getting the support that they need. It can be that there's multiple service providers, but that might be commissioned by different bodies, and that can mean that there's a lack of continuity in the care that patients receive. So it might be that patients don't know what services are available to them. It might be that they have to see multiple people, so they're having to tell the story again, and that can be really hard for people, and doesn't make people feel like they're understood. And aside from that, from the obviously the massive impact on patients, it also has an impact on the NHS, and there's quite a significant cost that's associated with that. So that's something that this project is trying to look at. What we find though is that there's limited evidence on how we can best support patients in moving from that being regularly admitted into the emergency department to actually being back in the community and maintaining that recovery. So in order to address that issue, there's a new role that's been introduced called a Recovery Navigator. Now that's being introduced across 6 trusts across North East and North Cumbria integrated care systems. We've got the map here which sort of demonstrates actually what a vast area that this role is going to cover. And the idea is that the recovery navigators are specifically going to target this group of patients who are regularly going into emergency care, but who for various reasons aren't engaging with the kind of traditional services that are there. So this role will be to provide more of an enhanced level of care, and it'll look at it'll take on a more holistic perspective. There was a study that was based in the North East, a qualitative study that found evidence to suggest that this is what patients want, a more holistic, person-centred level of care, and they felt like that would make a difference in terms of mortality rates, but in terms of kind of their improvements as well. So this is something that recovery navigators are hopefully going to take on. So that brings me to the study aim. So this is a kind of a broad aim to evaluate the recovery navigator role in their ability to provide enhanced support regarding the transition that patients are going to have from emergency care back into the community. So to look at this in more depth, the study's actually, the evaluation study is mixed methods, and we have 4 main work packages. The first 2 work packages are more quantitative based, so they are pulling routinely collected data to try and see what kind of impact the recovery navigator role has had. So how many patients are they seeing? It'll look at referrals that have been made and a whole variety of other aspects. Work package 3, sorry, is a more qualitative focused approach with interviews with patients, carers and staff, and that's more looking at the experiences people have had and the potential impact the recovery navigator role might have had on patients' well-being, as well as whether it's led to patients engaging in wider support services. And finally, work package 4 will be a staff survey that'll explore attitudes to alcohol care, and we'll be able to compare this with the previous survey that was done to see if there's been any changes. For the purpose of today, though, we're just going to focus on work package 3, so the qualitative evaluation. So I'm going to describe the methods, and this is what the initial plan was. So when the bid was submitted, this is what it looked like. We were going to conduct semi-structured interviews with around 20 staff and 20 patients. The focus of these interviews looked something like this. So for the staff interviews, the focus was about kind of the implementation of the role. How was it put in place? How was it adapted into the routine care? Were there any barriers and facilitators that have been faced in doing that? The patient interviews were more focused around what did the care look like, what did patients feel worked well for them, and what aspects would they want changed in the future. And then in terms of analysis, after transcription, there would be a 2-step approach. So firstly, a reflexic thematic analysis to try and really just see from the data what kind of themes were felt were coming through, what kind of issues were felt were coming through. And following that, trying to apply this to a normalisation process theory framework, which is a framework that's used when evaluating kind of the implementation of complex interventions like the Recovery Navigator. So our findings that we hope to find, we'll be applying those to the Recovery Navigator role as it's being rolled out across our region, but also if this gets introduced across other regions, there'll hopefully be lessons learned that we can apply. And there's the potential that it could lead to improvements in patient care. We'd also like to identify if there's recommendations we can make for both practice and policy. And I think really importantly, it's about building this evidence base for the navigators in how we can best support patients moving from emergency care back into the community. So hopefully all that's kind of set the scene a little bit about what we were originally hoping to do and the context of that. And so now I'll talk a little bit about the PPCEI involvement. So long-winded.
It just makes me laugh every time at that really long title. And as someone that is one of those people, I can never remember what it is if anyone was to ask me.
No.
You need to think of a catchier title.
I think we do, yeah. I hear different variations among this, so probably different people say different things. So yeah, we'll have to think of something catchier, you're right. For our project so far, there's been 4 key areas where we've had PPCEI involvement. So it looks a bit like this. So we've got 2 regional groups, one based in Newcastle, one based in Middlesbrough, that have met to help feed into the project. And these groups consist of members who have their own personal experience of alcohol use, mental health difficulties. There's carers within those groups, and we also had some support staff feed in to that. And actually, as it turned out, those support staff had their own previous experience of alcohol use and mental health issues. So I suppose they could provide different perspectives in their comments. The third group is a virtual group, so meeting through either Zoom or Teams, and that includes the carer of someone who's had experience of heavy alcohol use and mental health difficulties, and also a member of the public. And finally, the fourth element is around having PPCEI members who sit within our project management group. Fiona is one of these, but we are hoping to recruit somebody else to join the team as well. And so I'd just like to talk about some of the changes that we've made based on the feedback. So through these meetings and sharing the kind of materials that we're using for the studies and ideas we've had, we had a whole host of suggestions and changes to make, but the 2 that I'd like to pick out for today are around the kind of people who were planning to interview. So the first key thing that came back from the groups was that we really needed to include carers. And the second one was about our study materials and that we needed to make them more accessible. So I'll just talk briefly for each of those. So the first one about including carers. I feel like it seems like a probably very obvious thing to have done. And I think this maybe just speaks to the kind of way our research process is set up sometimes. So this was before I joined the team, but from talking with the team who were involved in putting the bid together, it was one of those situations where there was quite a tight deadline between the call coming out and having to submit your finished application. So there had been some feedback from kind of user panels, but it wasn't specific PPCEI feedback. And I think that was mainly because there just wasn't enough time. So I think probably if that had have been done at an earlier stage, the fact that we hadn't included carers probably would have been picked up earlier, and we could have maybe planned and sort of worked that into the original bid. But it didn't. So I'd be interested to know as well if other people have been in that situation and if it has been possible to work around that. Anyway, we sort of looked into the funding that we had received and to see if there was any flexibility within that of how we used our money, and we found that we actually did have a little bit of flexibility. So we've now made the change to include carers. So we're now going to interview 20 staff, 20 patients and 6 carers, and hopefully that'll mean that we'll get 1 carer from each of the 6 trusts that we're going to be interviewing. The second point that we received feedback on was about our materials not being very accessible, and I think a lot of the feedback from our groups was that the chances are it would instantly put people off taking part. Now, just to give you a bit of an idea, I've got a picture here. I don't expect you to be able to read what's on the picture, but this is kind of what our original patient information sheet looks like. It's 3 pages. It's got all the key pieces of information which we're required to provide to patients, but it's also pretty dull. So after talking with colleagues on how we can make it more accessible and taking on board points from our PPI members, we'll put together a shortened version. So this is what our shortened version looks like. We've tried to condense the information into one page. I should say as well that we worked with our lead NHS trust for the project, has a health literacy group within it, and they gave us some really fantastic feedback. And that was regarding the language that was being used, the layout on the page, the colours that were picked. So we've tried to take that on board and make something that's hopefully a bit more user friendly. And so far the feedback we've had has been positive so far. And finally, the other suggestion in terms of making it more accessible was to have a video version of this information sheet, which is something that we are aiming to do. We haven't done it yet, but it is something that we're hoping to be able to provide. That is currently ongoing. And again, this is something I'd be really keen to hear from people if anybody's done anything similar, to know what the experience was like and how well it was used. I should say as well, we haven't gone through ethics yet. We're in the process of applying for study ethics, so these things might be altered in some way, but this is what we're working with for now. So that is about as much as I'm going to say. I've got a page of acknowledgements here just to obviously acknowledge our funder and also the fantastic study team that we're working with. It is a really multidisciplinary team, and we have our project team meetings monthly and everybody feeds in. So it's been a really, it has been a real team effort.
Yeah.
So I just want to say thank you to everyone there. And I will now stop sharing. I'll try to stop sharing. There we go. And
now it's my turn.
Now it's your turn. If you don't mind, Fiona, maybe just talk me through your experiences.
They've all been really positive, but I think to talk about this project, I kind of would like to explain the journey to get me there. So probably about 6 years ago now, when I had my last breakdown, and things were really difficult, and I was using alcohol a lot as a crutch, and I went to the GP for help, and I felt like I was falling through the cracks as I get referred to services, but they weren't really, I didn't qualify for help in some way. So I got told to come to this place called Recovery, which I'm lucky enough now to work in, and I can't say enough good things about it. I know that hopefully you should get a link to the website so you can see the wonderful stuff this place does. But it really did help me when I didn't really think there was much point anymore. And now, after sort of recovering for a bit and the pieces getting put back together, somebody suggested you'd be really good at this. And it was a leaflet about being a lived experience member on interview panels for prospective mental health nurses. And I did it and I loved it. And then I found there was something called the Experts by Experience Network. So I started going along to that. And through that, I got the chance to join on some research projects with different universities, some of which I've done a few now with Newcastle University, and I've loved each one because it's like I'm getting to put the bad experiences that I've had to good use. So there was some point to me going through that, and I don't want people to experience the things that I experienced before because they were horrible and I wouldn't wish it on anyone, but let's have some good come out of it. And it also gave me a bit of purpose, and I think it also in some ways helped with my recovery. I've got, I suppose, so much knowledge and can look at things in certain ways that might not be seen by other people. Yeah. And sometimes when you talk about your experiences, it can be incredibly impactful and you don't even realise.
Yeah.
But I would like to encourage other people to come along and take some of the path that I've done in my recovery. So getting involved with research, it's so exciting to like have a voice in the future, being able to interview panels and seeing potential future mental health nurses. I get a say in maybe having someone having empathy and speaking nicely to someone, whereas in the past I've dealt with nurses who have not been nice and I've left feeling worse than I did before.
Yeah.
How's that going to promote people engaging and getting the help that they need if they come up with a barrier of a not nice professional and it just puts them off? So that's like one of the exciting things that I think has come out of it. And in the future, I want to encourage people within Rococo and the other networks that I'm in to get involved with this sort of stuff, because they've got so much knowledge and they could make a difference. I feel like I've made a difference and I'd like other people to make a difference. It's helped my self-esteem.
Yeah. Yeah. You've got a lot of passion for it.
I do.
Which is fantastic.
Yeah.
I wonder if you could maybe just say a little bit about the types of things because I know you've, like you say, you worked on a few different projects. What types of role have you taken on? What kind of activities have you been sort of involved in?
So I've been part of a workshop where we analysed some data that was taken that was done around people's experiences trying to access mental health services during COVID-19, and that was mainly around people that were homeless.
Okay.
And those were really interesting workshops, and it was sort of a few of us were bouncing off each other, and I think we might have picked out things that might not necessarily have been seen.
Yeah. And
it makes us, like, certainly I could reflect back on experiences I'd had on the past from things that people had said in that data. I find that really interesting, actually.
I think it is, though, because I think as a researcher, you sit with data and you read through it and you read through those interviews again and again and you become familiar with it. But everybody has their own kind of interpretation of that, don't they? So I suppose it's inevitable. There's some things that I might miss that you might see differently.
Yeah.
And, you know, vice versa. So it's nice to be able to capture, you know, someone who has lived through that and maybe picked up on those things that otherwise wouldn't be known.
I think also when I was really ill, I felt voiceless and that people weren't listening to what I had to say. And when I do this, I feel like I really do have a voice for the voiceless, and that is quite exciting.
Yeah.
Sorry, it really is.
It is.
I can't express how much passion I have for it.
So when one of our first meetings, when we were talking about you becoming involved in the management group, Fiona was telling me more about the Recovery College where she's working, and you were describing some of the ways you would kind of like to build those connections between the Recovery College and Newcastle University.
Yeah, I'd love to see more work together. There are so many people that come here that have so much that they could give and that could give you so much interesting data, I think, or a view when you're doing, is it qualitative data analysis, like stuff like that? Here's a section of society that gets forgotten about.
Yeah.
Let's give them a voice again, I think.
Yeah.
But fantastic. Some of the other projects I've done at Newcastle University have also sort of been similar to this. I'm involved in a project called Adept. If you've not heard of it, they're on Twitter. Have a look. It's great. And I've always loved going to the meetings. The other people that are on the PPIE, they're just all, it's kind of nice to make connections that way, and just like a nice bunch of people and getting to know more and more academics within Newcastle University as well. There's so many little things that have sort of popped up. I've had my finger in so many pies, it's unreal. But like, I suppose I kind of think of my recovery and my job as a bit of a journey. Well, I'd like to pass the baton on and give somebody else the chance to do this and make a difference. And again, give that voice back to the voiceless.
Fantastic.